And thanks for being with us again. I'm Lauren Maloney. Joining us now is Jody Kamon. She is a licensed psychologist and co-owner of the Center for Behavioral Health Integration. Jody, thanks so much for being here.
Thanks for having me, Lauren.
May is Mental Health Awareness Month, and just a few days ago on Friday, it was Children's Mental Health Awareness Day. We unfortunately know the pandemic has only put a bigger spotlight on this issue, and more recently we have seen with the number of inpatient beds decreasing around the state just how much this is affecting our young people. On a scale of 1 to 10, how bad is it?
Right now, I would say it's at least an 8, a 9. People are really struggling, and the reason I wouldn't put it quite at a 10 is that I think there's some hope. We are seeing some changes with vaccines and kids going back to school more regularly, and all of those things I think lend itself to a more hopeful outlook. But youth and young adults have definitely been struggling with isolation and struggling with the change in environment. We've definitely seen increases in our projects. We've seen increases in anxiety and depression, suicidal thoughts, and accessing providers is a real challenge right now as well.
The scarcity of not enough beds that parents are trying to bring their children and needing that last resort, almost that hospitalization resort. What are you hearing?
So we're hearing that just the struggle of knowing where to turn, and we are also, even among providers that normally provide outpatient services, they're not sure where to send folks that are at the door and they have a 2-month waiting list, and they're asking, okay, so who else in the community can help this family, help this youth, and they're really at a loss right now.
In a study done by Vermont's mental health commissioner, roughly 70% of young people reported that the pandemic has made their mood and anxiety a little or a lot worse. When this first started 14 months ago, did you foresee the problem getting as bad as it is right now?
Not necessarily, only because I think when it first started, I don't think any of us knew that it would go on for as long as it has, and that it would be just, so persistent and so pervasive, and that it would really affect families just so drastically.
I know you want to talk about this new innovative way to get some help to young people and young adults. It's called the Youth Screening, Brief Intervention and Referral. So tell me a little bit about that.
Sure. So this is an effort that we've been involved in since 2017 with youth and young adults, so ages 12 to 24. And basically, the idea is that you are doing universal screening. So at a school, for example, you ask all 9th graders about their mental health and substance use. And part of it is to reduce stigma. The idea is if you're asking everybody and you're introducing the conversation, you're doing 2 things. One is you're just saying, this is like getting your blood pressure checked. It's a topic we shouldn't be afraid of, and it's a topic people shouldn't be judged if they're struggling with. And the second part is you're trying to catch people early. So you were talking before about how, people are getting to the place where they're looking for residential or inpatient services. And our goal, part of the goal with ESPER, is that you're trying to identify symptoms as early as they start emerging, so that you can use community resources to really wrap youth and their families and try to prevent them from getting to the place where they actually need to go to an inpatient facility.
Right now, I understand you're working with Twin Valley and a few schools in Chittenden County. You're looking for more schools, more community support. Is that right?
Yes. So we do have this funding through 20 of 23, and we really would love to partner with both secondary schools as well as colleges. We have several colleges that we're partnering with, as well as, like you said, Twin Valley. And, in partnering with some of the high schools, what they've said is it's been helpful because they've identified students that they didn't know were struggling. And as a result, they were able to plug them into services. And if they couldn't get them into services right away, the school guidance team could at least keep checking on them and making sure they were okay. And what's also been from the youth side of it, we've gotten feedback from the youth that having somebody who they didn't feel judged them, having somebody that they felt was checking in on them, making sure that they were okay, that that really meant something to them. And it really was helpful.
After everything that's happened, after all of your research and everything that you're doing right now, what do you hope we can learn from this when we turn the corner?
That's a great question. You know, I think one of the things that we've seen in our work is the way communities come together to partner. So the way, for example, the school guidance teams have partnered with local mental health providers to look at how do we provide services and doing it in creative ways. Right now, we're working with Spectrum. They've been a huge partner in support of this. They're teaming with us all along the way. And we're looking at how can we actually increase the amount of mental health services available to youth and young adults in communities. And so I think part of what we've learned is that we need to get creative. We need to build more resources in order to be able to help youth and young adults and their families from not feeling so isolated.
Jody, we're going to put the website up for people who want to learn more about this. But I appreciate your work, and thank you so much for joining us.
Thanks for having me.